The other test that's extremely important is brain mapping test. This is also non-invasive, painless, with zero side effect. Because as soon as I say brain, people panic. It has zero side effect, it is painless, it is non-invasive, and it doesn't do anything to your brain. It only takes information from your brain to see how different parts of the brain they communicate to each other, how they control the body. We need to make sure we normalize your brain activity. So all the organs, they function neurologically in an optimal zone. Because when the organs, they don't function in optimal zone, it could be a neurological phenomena, the brain is not controlling them properly. It could be a vascular problem, there is not enough supply. It could be a hormonal problem where the vascular supply is good but the diet is crappy. You follow what I'm saying? So this is also a non-invasive, painless, zero side effect diagnostic tool, and as a result we do treatment, which we're going to touch on a little bit later. If your brain does not function in optimal zone, you'll have functional symptoms. Most people, they want me to explain that. Functional symptoms, they don't show on MRI or X-rays. That's a waste of time. Yeah, if you're looking for a tumor, it's good. But functional symptoms, that contributes to brain not functioning in optimal zone is memory loss, feeling depressed, anxiety, fatigued, messing up your children's name, inability to do simple math, going to work, you don't know how you got there, not responding to medications, not responding to supplements. Sounds familiar?
I'm much more energized, I'm more focused, I sleep better. I can actually work out in the gym now. My knees are feeling better, my back is better, and I hopefully if I can, when I continue coming here, I'll get even more stronger than before.
So when these symptoms that I mentioned happen, that usually indicates there is parts of the brain which controls your organs, like your thyroid, pancreas, gut function, adrenals. They can become underactive. That means they don't have proper amount of activity. And we need to increase their activity. Other parts of the brain, they may be overactive. When you have overactive parts of the brain, then it makes you not to be able to sleep. And we need to lower their activity. How do we do that? We do it with smart brain therapy. Smart brain therapy is a therapy, again, that is painless, non-invasive, with zero side effects that we do in this office. And what it does, it normalizes your brain activity. So as a result, you have more focus. As a result, a lot of these functional symptoms will get better. And the best part about this therapy is it does it involuntarily. So involuntarily, you're going to be watching a movie, involuntarily it normalizes your brain activity while you're watching the movie. Like I said before, it is painless, non-invasive, and with zero side effects. And the results in many patients are permanent. We use it a lot with attention deficit disorders for children, but mainly we use it right now with adult attention deficit. I say an example, it's similar to when you were as a kid, you learned how to ride a bike. You haven't ride a bike for, I don't know, 20 years, 30 years, 40 years. Now when you start riding it again, it comes back to you naturally because it is planted in your brain how to balance yourself on the bike. And sometimes when you even want to fall, when you're on the bike, you can't because the body doesn't allow you to fall. So if your brain does not function in optimal zone, no matter how much medication you take, no matter how much supplements you take that are good for you, you're not going to get better. Because your brain controls all your body organs. Your brain controls your thyroid. Your brain controls your liver. Your brain controls your pancreas, your stomach, your adrenal glands.